Hello, I'm Dr. Sabrina Asumu, and I'd like to introduce you to Boston University's Clinical and Translational Science Institute, or the BUCTSI for short. Before we get started, what is translational science? Translational science is the process of turning observations from research in laboratories, clinics, and communities into interventions and other outcomes that improve health. It creates pathways and partnerships, enabling medical research to connect to other types of research and to communities that need it most. Translation is a crucial process to improve modern health science and standards, but there are roadblocks in the way, which you can picture as walls. There are more walls than we can list here, but as an example, think about the issues that can arise when communities are not included in research, training and development opportunities are not accessible to researchers and medical teams, and systems of inequities and inequalities impede diversity in science. The BUCTSI is committed to a different future, one of science without walls. Science without walls allows us to share and develop health knowledge faster. Think about it this way. What if you want to build a prototype for a new medical device? That would mean working with doctors, researchers, technicians, engineers, and maybe even policymakers. In all of these cases, everyone is working in different spaces. They are separated. At the core of solving this problem is a translational scientist becoming a boundary spanner. They recognize that to solve a complex problem, you need complex and diverse teams who share knowledge and who can train each other in novel methods in order to create better research communities and health outcomes. The more boundary spanners there are, the faster research knowledge can impact the teams who can do incredible things with it. There are many other qualities of a translational scientist, but focusing on boundary spanners allows us to think about a future where everyone can adopt translational science principles into their own research action. It's a major keystone in science without walls. Here at the BUCTSI, we have many modules and activities to train and support the boundary spanners of the future. We offer funding to researchers and medical practitioners. I, myself, received a funding for a CTSI Pilot Award, and I am a Doris Duke Scholar. Our workforce development program supports our staff, preparing them to implement translational science and concepts into their own research. Our community engagement program enables us to work with communities through an advisory board in Boston Medical Center's health infrastructure. This helps us bring down walls between patients and health information and help us forge alliances for the future. Our health informatics team look at national and local data to study health and disease within the context of where people live. For 15 years, the BUCTSI has been committed to our goals and has been able to accomplish so much. But there's still more to be done. At the core of what the BUCTSI does is the understanding that no one organization or person is enough to solve the health burdens we see around us today. But through bringing together diverse experience, expertise, and perspective, a team can. The BUCTSI has much more in store to continue building a vision of translational science, and we want you to be part of it. Every day, we're using the principles of translational science to build a future of science without walls and build research pathways that can transform the future of healthcare.